Welcome back. Fascinating stuff here. A report just released by Navy medical researchers heralds a breakthrough that could make it much easier to pair organ donors with recipients. That is welcome news to more than 50,000 Americans currently awaiting an organ transplant. The new therapy prevents the immune system from attacking, quote, mismatched organs without using dangerous anti-rejection drugs. Joining us now to explain are the therapy's creators, Captain David Harlan and Lieutenant Commander Allan Kirk of the Naval Medical Research Institute in Bethesda, Maryland. Gentlemen, a pleasure to have you with us.
Well, thank you, Tom. Nice to be here.
I actually sounded a bit more educated on this than I really am. This is almost the stuff of science fiction to me. What does it mean in layman's terms?
Well, we're very excited by this work, Tom, as you are. But I think to answer that question specifically, I'd like to have Lieutenant Commander Kirk tell you the specifics of what we've done. Because Lieutenant Commander Kirk is a transplant surgeon and an immunologist, and he and his collaborator at the University of Wisconsin, along with the team we have here in the Navy, actually performed these very technically demanding kidney transplant experiments.
Did these on monkeys?
Yes, sir.
Yeah. Doctor?
It's long been a goal of transplant surgeons to try to transplant organs and allow them to be recognized by the body itself, rather than having to suppress the entire immune system and put people at risk for infection. And what this drug does is allows the immune system to be retrained so that the cells that would reject the organ see the organ itself, but the cells that would attack viruses and bacteria are left untouched.
Now, so I can be clear, the usual procedure is that even in an organ that is a match, the recipient has to take anti-rejection drugs for life.
That's correct. They are always at risk for rejection, and it should be stressed that despite this advance, patients should continue to take their medications the way they are prescribed right now.
And those anti-rejection drugs in the current procedures have all kinds of side effects. Now, but you're talking about a situation where even a mismatched organ can be transplanted, and those anti-rejection drugs, are they eliminated through this therapy?
We believe, in the experiments that were recently published yesterday, we have found that for those studies we used the most mismatched organs we could find, and the therapy still worked. There is reason to believe that more carefully matched organs would do better, but you're correct that this should liberalize the therapy, and that's another reason why we're very excited.
Now, what is the exact therapy, or can you tell us, again, in layman's terms?
It's the most simple way to describe it, and I want to be brief, is that the immune system, as Commander Kirk has described, knows to recognize specific things, and we used to think that alone was enough to activate an immune response. Now we know that there not only needs to be a recognition process, but there's also more or less an on-off signal, which is not specific, just a switch. And we have been testing therapies which basically prevent that on switch from being turned on.
Now, if this proves to be successful in more of your tests, this has ramifications for other immune system problems too, not necessarily just organ transplants.
Yeah, and as a matter of fact, I do want to emphasize that. The Navy for some time has sponsored us at the Navy Medical Research Institute to do immunology research, because as scientists and physicians, we're interested in the science and saving lives, but as military officers, we're really out there to save the lives of U.S. servicemen and women.
What are some of the immune system illnesses that could be taken care of?
Well, certainly autoimmune diseases like lupus, even possibly type 1 diabetes, juvenile diabetes, or rheumatoid arthritis could be impacted by this type of therapy.
And how long before it gets to us? It gets out of the labs and gets to us?
That's always difficult to say, but we are aggressively pursuing how to get this into clinical trials, and we can, if subsequent results are as promising as the results that we've achieved to date, Tom, I could anticipate having this in widespread clinical use within 5 years.
Gentlemen, you have a nation's admiration. Thank you much, both for being with us. Captain David Harlan, Lieutenant Commander Allan Kirk of the Naval Medical Research Institute in Bethesda, Maryland. A pleasure, really. Next, Julia Roberts on her new romantic thriller with Mel Gibson.
A stunning new development was announced today in organ transplant research. If it works in humans the way it does in monkeys, it will help thousands and eventually millions of people. More now from NBC's chief science correspondent, Robert Bazell.
It is a discovery that could make transplants of all organs, kidneys, hearts, lungs, and livers, much easier and more common. It could make it much simpler to find a matched organ and eliminate many of the terrible side effects of transplantation.
If this ultimately works in humans, it will, I believe, totally revolutionize the field of transplantation.
In the study out today, doctors at U.S. Navy laboratories successfully test an entirely new type of anti-rejection drug in monkeys. Patients now must usually take anti-rejection drugs for life, and the drugs often cause harsh side effects. The new drugs are given only for a few weeks after the transplant, and they have few side effects.
This is a non-toxic, short-course therapy which for long periods of time prevents the rejection of a transplanted organ, and that has not ever been done previous to this report.
The drugs grew from a new understanding of how certain white blood cells, called T cells, attack and destroy transplanted organs in the same way they destroy disease-causing organisms. The drugs act like a switch that turns off the T cell attack on the transplanted organ, but the drugs do not disrupt the body's normal immune response against disease.
The specificity of this is a goal that immunologists have searched for ever since transplantation has begun.
Jill McMaster, who needs a kidney, is one of the more than 50,000 Americans awaiting a transplant.
I'm optimistic. It may not help me, but it certainly will help others.
The first human tests of the new drugs should begin in about a year. If they prove effective, the drug should become routine in about 5 years, beginning a new era of transplant medicine. Robert Bazell, NBC News, New York.
On our health report tonight, exciting new research on organ transplants.
One that could revolutionize organ transplants by sparing patients a lifetime of taking anti-rejection drugs after transplant, even letting people live with donated organs that aren't a perfect match.